public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. Other individuals and the media may also be audibly and visually recording this meeting. All electronic devices are to be switched to a non-audible function during committee meetings. Madam Clerk, are there any changes to the agenda?
Yes, Madam Chair, there are changes to the agenda. We have 3 new communications items. Communication item 5.2, correspondence respecting employment services transformation. 2 pieces of correspondence under this item. 5.2A is correspondence from David Cronin, the Director of the Program Delivery Service Branch, from Employment and Training Division from the Ministry of Labor, Training and Skills Development, respecting a call for proposal for service system managers, employment services transformation. The recommendation there is to be received. Item 5.2B, correspondence from Susan Irwin, Assistant Deputy Minister, Social Assistance Programs Division, Ministry of Children, Community and Social Services, respecting employment services transformation, transition planning for prototype regions. We also have item 5.3, correspondence from Janet Lewis-Deely, Board President of the Native Women's Center, respecting Mountain View Emergency Shelter operations. The recommendation for this piece of correspondence is that it be received and referred to staff for action and report back to the Emergency and Community Services Committee, and also referred to the Expanding Housing and Support Services for Women and Transgender Community Subcommittee for information. This last item is not published online yet, but it's been circulated just now. We also have one of our delegation requests, item 6.2 from Susan Morgante from the Hamilton Social Action Network regarding the crisis in social assistance, where there's been no cost of living increase in 2019, but there has been an increase of 7.6% in food costs, has been withdrawn. And then finally, we have discussion item 10.3, School Board Labor Disruption Report as HSC 20011 citywide.
Thank you, Madam Clerk. May I please have a mover and a second to approve the agenda as amended? Councillor Marola and Councillor Nan. We will electronic vote. And passes. Okay, are there any declaration of interest? May I please have a mover and a second to approve the minutes of the January 16, 2020 meeting? Councillor Clark, moved by Councillor Nan. We will require an electronic vote. And that's carried. Communication 5.1, correspondence from the Honorable Minister Todd Smith, Ministry of Children, Communication and Social Service, respecting the Poverty Reduction Strategy Survey. Recommendation to be received. May I have a mover and a receiver? Councillor Marola and Councillor Nan. Any opposed? All in favor? Carried. 5.2, correspondence respecting unemployment service transformation. 5.2A, 5.2B, respecting employment service transportation, transition planning, and protocol regions. Recommendation to be received. At this time, I would like to call Paul Johnson, General Manager, Health and Safety Communication, to briefly comment on this item 5.2A and 5.2B. Paul.
Thank you, and through the chair, 5.2, both portions of that relate to approval you provided to us in the fall, well, actually in the summer and the fall, to go forward and actually submit as part of the tender process for the service system manager role for Employment Ontario programs. As you can see, the City of Hamilton was unsuccessful in its bid to be the service system manager. In this region, which covers Hamilton, Niagara, Brant, and Haldimand, Norfolk, FedCap will be the service system manager, and they have a consortium of organizations that they're working with. Important to recognize that this is for the delivery of Employment Ontario programs, which the city does not actually deliver Employment Ontario programs. Several nonprofit organizations, our local community college, do. So they will be working with us, though, as the municipality and responsible for Ontario Works, as well as other organizations, to determine how best to set up a system of employment supports for job seekers in this community. So obviously, I'm disappointed in the outcome. I would have preferred that we were selected as the successful proponent. And I do want to, at this time, thank the many staff people under the leadership of Grace Mader, who pulled together what was a truly first-class application that really would have helped this region move forward. So I do want to thank them for their work, and I did just want to mention that this is about Employment Ontario programs, though we will be connected in some way with this through our Ontario Works department.
Thank you, General Manager Paul Johnson. And may I have a mover and a seconder to receive this? Councillor Jackson and Councillor Marola, all in favor? Carried. Okay, 5-3. We have a correspondence from Janice Lewis, Deeply Board President, Native Women's Center, respecting Mountain View Emergency Shelter Operation. And I would like Paul Johnson, if you could comment on this item, please.
Sure, thank you. And through the chair, I know you're receiving this letter as you arrived today. This letter was confidential. As you can see, it's dated today. I can tell you it's public now. The staff at the Native Women's Center have been informed that the board of directors of the Native Women's Center has made a strategic decision to no longer operate, as of June 30th, their emergency shelter beds at their Mountain View location. I just want to comment on a couple of things, and then, as you may understand, we'll need to take this away and come back with some recommendations on how this moves forward. One is, this is a decision of the organization to focus on other parts of their work which are unaffected by this decision. So this only pertains to the 15 emergency shelter beds that they operate in conjunction with the funding provided by the City of Hamilton and the broader shelter system. So all of their other services are unaffected by this decision. And secondly, they're not taking this decision because of any action that the city was making. This is a decision that they made as an organization, and they want to work with the city to ensure that there's an effective transition period. It does say that their preferred closure of this program is June 30th. We have had a chat with them to say that as we develop plans with the rest of the women's organizations that deliver emergency shelter and affordable housing options, if we need to be flexible on that date, they're certainly willing to have a conversation with us about that. I do want to articulate the second very important thing, is that for women in this community who experience homelessness, nothing changes today. They are still able to offer, access the programs at Mountain View, and will continue to do so until we come up with a transition plan for these beds. These beds are, of course, funded by the City of Hamilton. That funding will be available for the reallocation of these beds within the system. So at this stage, we're not able to provide you with what the next steps are, because obviously this is happened very, very recently and was only made official with this letter that we received today. So we will have our staff work through this. I did alert the ward councillor of this just before our meeting, so Councillor Danko is aware, because he's not a member of this committee and it is in his ward. And I do want to thank our staff, and particularly Rob, who's sitting behind me here, and his team, who have been working with our other providers to make sure that they know about this information today as well. The Native Women's Center was very adamant that they had a chance to tell their own staff before anyone else was shared this information. So as I said, that happened this morning. Happy to take any questions on this, but recognize we'll be back next month with some more information about our next steps on this approach.
I don't see anyone. Oh, we do have one. Councillor Nan.
Thank you. Through the chair, disappointing news. Although I just wanted to clarify through you, Chair, to General Manager Johnson, did I hear you correctly that the funds that that made the 15 emergency shelter beds available were funded through the city, and those funds will become available for reallocation within the system?
Through the chair, that's correct. So there's no loss of funding, nor is there any loss of beds at the end of this. The beds will need to be reallocated in some way. So we are not in any way suggesting at the end of this process there will be 15 fewer shelter beds in the community, nor is there less money for those shelter beds in this community. But the process for how those are allocated, where those might be placed. And we also have the challenge, as you well know, that we're actually looking at how we can increase the number of shelter spaces that are available for women, given the overcapacity situation that we're quite often in the women's system.
And through you, Chair, then General Manager Johnson, will the funding for the 15 beds for single homeless women remain in that priority group?
Well, through the chair, absolutely. This is not a reallocation to other areas. This will be how do we, at the very least, keep the total number of shelter beds for women at the same level. But we've already, yesterday, as we chatted a bit about this, looking at ways that we engage this service-providing community to figure out how we might increase the numbers. If we are going through this exercise anyways, it's a good time for us to look at how we would increase.
Excellent, thank you.
Thank you, Councillor Mann. Councillor Clark.
Thank you, Chair. Can I ask, the 15 beds, were they at capacity on a regular basis? Do we know how essential those services were into that particular agency?
So through the chair, in terms of the beds themselves, absolutely critical to the system, at capacity or at times over capacity. I think if you looked at a total year, if memory serves me correct, we were in the high 90s for a previous year, and sometimes at over 100%. So in terms of utilization, nothing to do with utilization, nothing to do with the need for these spaces. Yes, they're an important part of the system, and they need to be maintained within the women's system.
So is it fair to say that they're just rearranging what their core service is as an organization, and the 15 beds were not a part of that in their mindset?
So through the chair, absolutely. And as you see in the letter, they had been thinking about this and discerning where to go as an organization for quite some time. I will say that we'll be working with the Indigenous serving community to determine how we support the Indigenous community. Some of their comments to us were that, largely speaking, those beds were not for Indigenous women only in terms of the utilization. So this was very much a mainstream service, and so I think in some ways we need to say, well, how best can we support the Indigenous community and also keep more mainstream beds within the system? And so some of that may have factored into their decision as well.
So they're giving us the closure date of June 30th. When do you think you'll be coming back to this committee with some suggestions in terms of how we're going to provide contingencies?
So through the chair, one opportunity for some focused discussion with both the provider community and members of council happened at the newly formed subcommittee, which I think is meeting on March the 6th. So there'll be some discussion there. We are having some discussions with the women's serving community that we meet with regularly, and our expectation is we'll be back with a bit of a process map for you of how we're going to move forward at our March Emergency and Community Services meeting late March.
Thank you, Mr. Johnson. I look forward to it.
Thank you. No other speakers, so may I have a mover and a second to approve the communication 5-3? Councillor Nan and Councillor Jackson will need an e-vote. Okay, thank you, it's passed. Delegation requests, 6-1, and Elizabeth McGuire, and 6-3, Greg Blondin. And may I have a mover and a seconder to approve the delegation requested as presented? Okay, we need Councillor Jackson and Councillor Clark. We need an e-vote for that. Okay, consent item 7-1, Deputy Fire Chief appointee. And at this time, I would like to call upon our Chief David Cunliffe, Chief of Hamilton Fire Department, to introduce 7-1.
Thank you very much through the chair. It's my privilege today to introduce to committee Deputy Chief Mark Hodge. Chief, you could stand up. Chief Hodge. Chief Hodge is a 31-year-plus veteran of the Hamilton Fire Service, originally starting his career in Ancaster with Ancaster Fire. He's climbed up through the ranks, holding all the various ranks. Very much somebody that has dedicated his career to training and mentoring young firefighters. He's got a wide reputation around our department in terms of somebody that is a skilled and valued incident commander. Somebody that is certainly looked up to with a great degree from our young staff. And as you know, we are a young fire service today, and I know that Chief Hodge, in his new role as deputy, will play a large role in helping us to get these folks ready for the future and to help them to engage and take ownership as we move forward. So thank you for that.
Thank you. Welcome, Mark Hodge. I know that you will lead with integrity, honesty, and most of all, with compassion. I know that with the leadership of the Fire Chief, Dave Cunliffe, our fire department is in good hands. I know that our fire department personnel have a special calling. They do, because all the 911 people that take this office has to have compassion, and I want to thank you for taking this position. But I see that today we have our Deputy Chief John Verbeek. I heard this is your last day or tomorrow? Tomorrow. Well, I just did a little research. Since joining the Hamilton Fire Department in 1982, that's 38 years ago, Deputy Chief Verbeek, he has held many positions, including Fire Safety Inspector, Fire Safety Officer, Public Information Officer, Assistant Chief Fire Prevention Officer, Assistant Deputy Chief and Deputy Fire Chief, Operational Support and Community Safety. Throughout your career, Deputy Verbeek has always led with integrity, honesty, and compassion. His positive attitude and passion for helping people has a significant impact on everyone he has worked with. Deputy Chief Verbeek has always demonstrated a genuine interest in the well-being of our staff and has built many strong relationships over the year, which is a testament of his true leadership that he is. Over the past 2 years, Deputy Verbeek played a significant role in the development of our update community risk assessment, the 10-year fire service delivery plan that is now the roadmap of our department's future. I wish you and your wife, Mary, the best in the next chapter of your life. Thank you for your dedicated work. And I hope you take up golf like my brother-in-law. He's waiting for you there. Okay, so may I have a mover and a seconder to approve the recommendation to this report? Councillor Jackson and Councillor Marula. Can we have a vote, please? Okay, Ministry of Health Ambulance Service Review. I would like to call upon Michael Sanderson, Chief Hamilton Paramedic Service, to introduce 7.2.
Thank you very much, Madam Chair. Item 7.2 is the actual ambulance service review. We go through the periodic process with the Ministry of Health. It's required every 3 years. Out of that process, which incorporates a large range of activity with a large team. I believe the team in this case was a review team of around 10 people. They come to the service, go through all of our vehicles, our equipment, our records, all of the activities, including riding out with our paramedics to observe patient care to ensure that we're in compliance with the regulations and the standards that are established by the province. The actual review was done in May of last year. The draft report came back to the service in September. We responded to the draft report. We had our final inspection visit from the ministry to finalize the review in December and received our final report in January. As a result of the review, the service has received certification for another 3 years of operation, so the city is licensed to operate the ambulance service on an ongoing basis, which is not a surprise to me. The dedication of our people and our staff in terms of making sure that they're doing the right things is absolutely essential to the operation of the service. We would not go through the review successfully in any way, shape, or form without the support of all of our people, frontline paramedics, support staff, schedulers, administrative staff. It's very much a very large operation. I can tell you from my perspective, having gone through service reviews many times and having helped to create the ambulance service review process back in the 1990s, we did extremely well in the process, very few recommendations, and I am very pleased with the actual results that are coming from it, including the positive notes that the ministry has included in it. I found it a bit unusual that out of the observations that they made, 4 of the observations were really commendations to the city and to the service for the activities that they'd undertaken and the way in which we manage our service. So I was quite pleased with that. Thank you, Madam Chair.
Thank you. Thank you, Chief. And we do have a couple of questions. Councillor Clark.
Thank you. So the only thing that seemed to be outstanding on the item was a valid certificate signed by a physician, which seems to be kind of a technical, because they were signed by basically practicing nurse as opposed to the physician. So can you just comment on that? I'm assuming all of them are there. There's just a question of who signed them.
Through you, Madam Chair, you're absolutely correct, Councillor. We do have records on file for all of the different immunizations. When the ministry goes through the process, they select a large number of personnel files to ensure that all the required documentation is in the files. I believe during this review, they looked at about 140 or 360 files. Out of the 140 files, they identified 39 individuals whose immunization records were not signed by a physician, but instead were signed by a physician delegate, which may end up being a nurse practitioner, a registered nurse, or some other person that's been authorized by the physician to provide that immunization. The challenge that we face in going through that is many of our paramedics have received their immunization in a prior period when the ministry was not as rigorous in enforcing that requirement that's outlined in the legislation. And we have a choice of having the paramedic go back to their physician, potentially having re-immunized and looking at their records, which may actually require re-immunization of the individual because that physician may not be their original physician that delegated to the nurse or to whoever's done the signing. That would include immunization against tetanus, diphtheria, pertussis, poliomyelitis, measles, mumps, rubella, chickenpox, varicella, hepatitis B. So it would be an assortment of any of those immunizations the person may or may not have had a physician signed off on. We have checked with our medical officer of health. We have a good process in place going forward, and we are asking our paramedics when they have the opportunity, if they have old files that have a non-physician signing, to have their physician update them. But it's a difficult process, and we have to be respectful of the time for physicians in terms of their care. And the actual utilization of healthcare resources in order to basically clear up what I believe is a bureaucratic error.
Well, and it's a Ministry of Health bureaucratic issue as opposed to ours. Our people did what they're supposed to do. It's just a question of who signed the document. So the ministry, I'm assuming, is aware of the issue and that we're working to resolve it for the next go-around.
Through you, Madam Chair, the ministry is aware of it. I could also tell you that our association provincially has recommended changes to the regulations under the Act to facilitate a physician extender or a physician delegate to sign off on the immunization, but that's not being actioned at this point.
Thank you. Congratulations on the good findings. They're not easy to get, and not all the ambulance services across the province have been received so positively by the ministry, so well done.
And yes, thank you, Chief. You know, as I was talking about the fire department, we think the same as our paramedics. They're dedicated people with passion and people that care. And under your leadership, we could see how wonderful it's working, how they care for the people of Hamilton. So I want to say thank you to you as well. Thank you. All right, let's move on. May I have a motion, a seconder, to receive this Minister of Health? Councillor, oh, you're so happy. Councillor Jackson and Councillor Marola. Sure. Carried. Okay, 7.3, Residential Care Facility Subsidy Program. I would like to call upon Rob Mastroani, Manager, Residential Care Facility Subsidy Program and Emergency Shelter Service, to introduce 7.3. Rob.
Through the chair, thank you. Through the chair, following up on the last presentation in December regarding the residential care facility subsidy program review, there was a motion to refer 2 items back to staff. The first is discussed in the follow-up report regarding the need for an RCF complaint line where residents can lodge a complaint without fear of retribution. Such a venue exists with the RCF complaint line that is already in operation, which is monitored by licensing and bylaw services and provides the opportunity for RCF residents and public to file concerns. The second item is in regard to feasibility of developing an RCF advocate's office. At this time, further consultation and development is required, and investigation is required, which we will incorporate into both the ongoing RCF subsidy program review as well as the licensing review processes that are underway. So I'm happy to answer any questions at this time.
Okay. All right, Councillor Clark.
Thank you, Chair. And I appreciate staff's review. But it seems rather perfunctory to me. The request was to look at a policy protocol or bylaw that would protect residents in residential care facilities from any form of retribution for reporting a health or safety concern. My motion was not that we have a hotline and that it be anonymous, because the anonymity of a hotline does not mean there's not going to be retribution. That doesn't guarantee no retribution. What guarantees no retribution is a policy that tells the RCF operators that you cannot retaliate against someone who's filed a complaint with the city. So when I look at the policy and the request that I put forth, your response to it is not really answering the question.
So through the chair, thank you for that feedback. We can absolutely take that back and investigate further and report back to committee on an additional plan or some more of a process in place that would meet those needs.
And it may be just a misunderstanding in terms of what the resolution was, but the resolution was worded in such a way that we're going to develop protocol or policy that would ensure that there was no retribution. And so the intention was not anonymity. We have that now. That's not working. The intention was to ensure that RCF operators could not retaliate against a resident if they complained about something that was occurring within their facility. That was the intention. And so that, with respect to Mr. Mastriani and Mr. Johnson, means that there has to be a policy written and it has to be shared with the operators that they cannot evict someone because they complained that they were eating rice for 30 days in a row. That's the intent of the resolution. And I don't think this report responds to that. And I still would like to hear more information at some point. I understand others don't have advocates' offices, but it doesn't mean that we can't.
Through the chair, the second piece is, as we say, not lost. It will be part of there will be a number of changes that happen within the overall bylaw review for RCFs and the whole funding envelope request. So I think that second part, not lost, just better suited to the larger conversation. On the first piece, I can say our discussion was more around, and it might have been our confusion, and we will solve the second part, was there was some confusion. I don't think we gave a crisp answer about where people would actually call if they did have a complaint. So we've clarified where people will call. But absolutely, it's a policy that can be done, but the other piece is it actually needs to be written into our contracts so we can write it into our funding contracts with our RCF folks. So we'll take away that second piece, and you can consider this an outstanding item. We won't remove it from the OBL if we can figure out a way through the clerk not to have this removed from the outstanding business list, and we'll bring back those additional components.
Thank you, Mr. Johnson. So I mean, at the appropriate time, I would simply refer the report back to staff for further investigation. I understand in the long term the need to attach it to contracts, but in the near term, ideally, we'd like to have a policy that says you can't do this, so that they know that in the long term that this is going to be attached to a contract. So that would be my suggestion. if my council colleagues agree with me, we can just refer this back and then have it come back as another report.
Thank you. I would like to ask, can I pass the chair to Councillor Nan? Thank you. I just wanted, I saw on page 2 or 3, Rob, that you looked at other cities and they don't have an advocate office. It doesn't in any community. Is there any communities that have advocate?
Through the chair, in terms of the investigation that we completed with reaching out to municipalities we know operate similar programs within their municipality, there is not such an advocate's office.
And can you just explain what an advocate would do? What kind of role would it be, the role of an advocate?
Through the chair, I think that could be something that we can investigate to clarify what that role would be, but to, I guess, receive complaints so that it is a third party or an arm's length extension of the program that can investigate the complaints or processes within the system and try to support the residents to action those concerns or those issues that they might be experiencing.
Because I had the same train of thought as Councillor Clark. Would people call in and say they have a problem, or as a family member would take a part in it, making sure that they go in RCF that are well kept, that are treated well? Is there?
Through
How
the
would you
chair,
expand that?
through the chair, I think those are very good points, and I think that is something that we can look to develop into that process. To the point earlier, we may not have done as much investigation that we could in a future update.
Okay. I want to, can I ask Councillor, can I ask, I don't know who would answer that, but when a person goes to a registered care facility, who gets the subsidy? Does the person that cares for the person or the care facility? It goes straight to the care facility, or?
Through the chair, yes, it goes to the operator of the home through a payment through Housing Services Division.
Does all cities do that? Like,
Through the chair, I'm not certain, so I can investigate.
I'm just wondering if there's a model where the people that care for their people, they would receive it and then put them. Is there any model of that in any city, or does it go straight to the care facility so that when they receive the money, they could do, whatever they want, or the responsibility of a family member would be more?
Well, through the chair, not every community has residential care facilities
Okay.
of this style. Generally, with communities with these facilities, it's done through a facility agreement, so the subsidy flows to the organization. However, as you know, in support of housing, more and more of the movement is to provide portable, what are called housing allowances or portable housing benefits to individuals. And in fact, the larger review of the RCF system is to see how we can start to bring this system more in line with where other types of affordable housing are going, where the resource is invested in the individual, and they have the opportunity to seek, and it essentially helps the individual to lower the costs of their housing area. But in communities that have residential care facilities, as you see in Hamilton in this system, it's generally funded in a similar way. Also important to note that not all residential care facilities have an agreement with the city. In fact, many don't, and so those are directly paid through other means by the individual.
So there's 90 and 53 are, is it 37 that are independent, or?
So through the chair, there are approximately 90 that are licensed within the city of Hamilton as residential care facilities. Housing Services Division has a contract for subsidy with 53 of those homes.
53. Okay, thank you. Any other, thank you. There's no other questions, so are they, may I have a mover? Oh, Councilor Clark, sorry.
Thank you. So to answer the question that the chair asked with regards to the advocate's role, many of these residents have severe mental illness, are mentally challenged or physically challenged, and they don't have families who advocate for them. and they're placed in these homes, and they live in these homes, and they're really at the direct care of the operator. So if there are challenges, who do they go to advocate on their behalf? And advocates, when you're looking at advocates, that I'm thinking of KMH and psychiatric advocates for the mentally ill in Ontario, the advocates played a role of mediating and helping to move the system to assist these residents without getting into a compliance issue or an enforcement issue. So when a resident is calling to complain or they have concerns, then the advocate can come in and advocate on their behalf and move the bar, move and solve the situation without it becoming an enforcement issue for a municipality. So that's the intention of an advocate, and I think it's something that we still should be exploring.
Thank you. Okay, may I have a mover and a seconder? Councillor Nan, Councillor Clark, and second by Councillor Nan. All in favor? To refer back. Do we need, yeah. We'll have an e-vote to refer back. Thank you. Okay, passes. 7.4, Housing and Homelessness Advisory Committee minute. 7.4,
Madam Chair,
Oh.
sorry, we still will need to receive that report.
Okay.
In 7.3.
all right. May I receive the report? A mover, Councilor Marola and Councilor Nan. All in favor? Carried. Okay. 7.4, Housing and Homelessness Advisory Committee. 7.4 and 7.4B, move. All in favor? Any opposed? Carried. Okay. Councilor Marola and Councilor Jackson. Senior Advisory Committee, may I have a mover? Councilor Nan? I will second all 5 of them. All 5 of them, great. Okay, all in favor? Carried. Okay, we're at the public hearing delegation now. Dr. Sally, I would like to call upon Dr. Sally Palmer, McMaster Community Poverty Initiative, to delegate respecting the decision of Ontario government to give a no cost of living raise to social assistance to 2019 and the escalation of food prices 2019. Please come down. Dr. Sally Palm, welcome, and you have 5 minutes, and if you go longer, we might extend it.
Thank you, Madam Chair and councillors. So we're here because people who have to survive on current rates of social assistance are in crisis because of inflation and government inactions. We know that you wrote a letter or decided to write a letter at the last meeting, but that letter was general. We want them to get some statistics from Hamilton, which we'll give to you. So the McMaster Community Poverty Initiative is asking you to support a motion to have the mayor write to the premier and relevant ministers, such as Children, Community and Social Services, Finance and Health, urging them to make a substantial increase to social assistance rates to compensate for giving no increase in 2019. You'll see later that they don't admit to the fact that they didn't give an increase. And also that 2019 was a year of high inflation to food prices in Ontario. So it was inflation with no government response in 2019 that led to a crisis for Ontarians dependent on social assistance. The food prices increased by 7.6% across Ontario. This was the biggest annual increase in a decade. And this was reported by the Medical Officer of Health in Toronto to their Board of Health back in October. The effects of inflation on people dependent on social assistance have been ignored by the government, and they gave no cost of living increase in 2019. Now, how much does healthy eating cost in Hamilton? I understand that the Public Health Services sent the councillors this report, but normally it has come through the Board of Health. So the hardships of people who depend on social assistance in Hamilton are shown by the 2019 report by Public Health Services on the monthly cost of a nutritious food basket. And the worst people off are the single recipients of Ontario Works. After paying an average monthly rent for a bachelor apartment, they are $236 short of being able to buy a nutritious food basket for a month. This deficit more than doubled in 2019 compared to 2018, when the deficit was only $101 per month. It's never increased this way until this past year. There's been a steep downward slide in the buying power of social assistance that began 25 years ago. The reduced buying power of social assistance began with a harsh 21.6% reduction to the rates by Ontario's last Progressive Conservative government in 1995. And it's been on a downward slide ever since. And I'd like Brian Russell to stand up. Brian's here today, and he is a Hamilton man caught in the current crisis. He's 62 years old now. He was out of the job market for 12 years, caring for an ill mother. On his return, he could only find work that was precarious and physically draining. And eventually, the effect on his health made him turn to Ontario Works. Brian's comment on food inflation in 2019, this was about a month ago, was, "I have never been this poor." And this is the way for many people. This chart shows the downward slide that started beginning in 1993, before the PC government came in, that the 100% is where that's how much they had, whether they were on social assistance for OW or ODSP. And I don't know whether, yeah, it's in color. So the blue line shows that there wasn't this huge drop. They didn't cut the 21.6% off from people on ODSP. They did it to the group on OW, because there's never as much sympathy for people that aren't handicapped. And right now, if you look at the chart, at the amount of food people can buy if they're on ODSP is about 78% of what they could buy back in before the drop. And for people on OW, they can only get about 64% of the food they could get before the slashed amount. This is a picture of us going to Toronto, and I'll be talking about that in a minute. Many of us are here today. So we're here to talk to you and want you to write a second letter because the Ford government is unresponsive to advocacy groups like ours. And the group of us who went to Queen's Park, there were 20 altogether, have taken continual action to, okay, is that 5 minutes?
Thank you. It
So
was
I can't-
extended, you could keep talking. Oh, a vote, okay. We're
I
going to
can-
vote first? We're going to have
Okay.
a vote.
I'm nearly through. I seconded Councillor Thank you.
So, okay, thank you.
Okay, so we've taken continual action to urge the government to respond to the growing gap between social assistance and the cost of living. And I'll just mention direct confrontation. That was the trip to Queen's Park that I showed you a minute ago. So at Queen's Park, the NDP helped us confront Minister Todd Smith in question period back on December the 5th. MPP Monique Taylor asked Minister Smith why he had not increased social assistance in 2019. His answer was, our government already increased rates by 1.5%. And then he paused and he said, earlier this year. Well, we looked up in Hansard and that's what he said, and it wasn't true. So our request is we've given you new facts about the suffering of people in Hamilton who have to survive on a static social assistance allowance while food prices are increasing significantly. We're asking you to support a motion to have the mayor write to the premier and relevant ministers, and the letter would urge the government to make a substantial increase to social assistance rates to compensate for giving no increase last year, a year of unusually high food prices in Ontario.
Thank you. There's few questions, so if you
Oh, yeah.
can stand there
Okay.
and, okay, Councilor Marilla.
Thank you, Madam Chairman. And Sally, or Doctor, it's always a pleasure to see you. I know over the last 20 years in working with you on a number of issues, you've been a champion, and it hasn't been recognized to the extent that it should have been, but it shall soon. I
Thank
must
you.
say. You're welcome. But through you, Madam Chair, can you elaborate on the economic uplift that social assistance directly has to the local economy? As you know, Madam Chair, when we're looking at the average Ontario Work recipient, the amount they're receiving is directly being spent in their neighborhoods, not saved in banks or in offshore accounts or so on, but in their neighborhoods. Can you just elaborate on that?
Well, yes, the people on social assistance have to buy the basics. They don't even have enough for that. So their money goes right back into the economy, and they aren't spending it on trips anywhere. They have to spend it on basics. They also are often the people that get involved with the police. So police services are directly influenced and made more onerous because of poverty and the results of it. Then the health services. I know that people who are low income end up using, as a family doctor, they use the emergency room of a hospital. And it's very discouraging to people working in these hospitals, see the same people coming back. Often they become addicted because of early experiences and the feeling that no one really wants them in the community. So it does become more expensive.
Right. So I guess a lot of people, through you, Madam Chair, look at Ontario Works or social assistance as a burden, when in essence it is a significant investment in our economy and something that can't be understated. You just have to speak to any variety store or grocery store or any local business person. They recognize the direct correlation between when those checks are issued and what their revenues show. And that's something that we need to highlight as an investment opportunity. So also, with respect to what I believe to be the biggest crux of the problem, through you, Madam Chair, is that I think a lot of people will concur that opportunity leads to employment, which then leads to coming off of Ontario Works. The sad reality is that because of years and years and years of changing the criteria for eligibility for people with disabilities, we have a significant amount of people presently collecting Ontario Works that should technically be collecting Ontario Disability. Could you elaborate on that particular crisis and how unfair and undignified that really is?
Yes, at one point, the lawyers in the Hamilton Community Legal Clinic were spending 80% of their time arguing for people to get on ODSP. The average person, I'm not sure what it is now, but the average person applying for ODSP had to apply 3 times and get turned down the first 2 times before they ever got accepted. And I've talked to people who didn't apply after they got turned down once. They felt humiliated by the whole experience.
Right. And that's exactly, through you, Madam Chair, I think that is exactly created by design.
Yeah.
They've taken a very private sector insurance model and applied it to the public sector, and that is a shame and a disgrace. So at the appropriate time, Madam Chair, I'd like to move a motion to support Dr. Palmer's motion or initiative, and I presume that'll be seconded by Councillor Knapp.
Yep, that would be great.
Thank you.
And we'll do it at appropriate time. Okay, Councillor Clark.
The only thing is that there's another delegation here who wants to speak to the same thing. So,
So we'll do
is
it
that
at the
okay?
end.
Okay.
So can I ask the doctor, I heard you indicate that the Minister Smith said a government already increased it by 1.5% to those on social assistance earlier this year, and that you looked to see whether or not it actually had happened, and it had not happened. So
It
the
definitely
1.5
did not happen.
it
Tom
did-
Cooper of the Hamilton Poverty Roundtable can tell you that. And I've seen it in other places as well.
Thank you, that's very helpful. And you also indicated you'd like the letter to urge the government to make a substantial increase to social service assistance rates. Do you have any definition on substantial?
Well, one of the people who's going to be speaking, Elizabeth McGuire, is saying that it should go up to $952 because that's when the drop occurred. If that drop back in 1995 hadn't happened, it would be now 952, I think.
Okay, so we'll wait to hear from Elizabeth and we'll
We
go
are
from
just
there.
asking for substantial. I figure to ask this government for a substantial amount is probably wasting one's breath. But they should certainly have given that increase last year.
Well, I think we're happy to assist with another letter. Thank you.
Okay, no more speakers. Thank you, and
Okay.
we'll do the motion later. 8-2, Sherry Silway. Oh, can we move to receive?
We can do that all
That's what
together.
We'll do it all together. Yes, okay. I would like to call Sherry Silway, Canadian Federation of University Women, Hamilton Respecting the Crisis with Social Assistance Rates, with a focus on how women and families are particularly affected. Thank you, and you have 5 minutes.
Okay.
Thank you, Sherry.
Thank you very much. Thank you for having us today. We are here also to present our concerns about food insecurity and the cost to society. So my name is Cherise Selway. I'm a retired teacher and with the Canadian Federation of University Women. And this is Myrtle Grav. She's also with the Canadian Federation of University Women and a former social worker. 100 years, we've been a group for 100 years nationally, and we're also have an international affiliate, the Graduate Women International. Our group advocates for social justice issues, and we raise money for scholarships. So the right to food is a human right. Adequate, nutritious food. There was no increase in OW or ODSP in 2019. However, housing continues to be a huge roadblock, and the price of food has gone up also, as Dr. Palmer has said. It's also included in the Universal Declaration of Human Rights, which was adopted by the UN General Assembly in 1948, and it's spelled out in the International Covenant of Economic, Social, and Cultural Rights, which we signed in 1976. So the bottom line is we have a legal obligation to respect, protect, and fulfill the right to food. So food insecurity means that we have inadequate access to food. In Hamilton, it would be because of income. In other places, it may be different reasons. It also entails the worry about what you and your family are going to eat, which causes chronic anxiety. When you're insecure, you may eat outdated food. You may eat food that's not good for you, just cheaper and more filling, like a lot of pasta, cereals, and you also may skip meals. Parents will wait until their children have finished eating and then eat what's left over so their kids can have enough to eat. And it's even harder if you're on a special diet. For instance, if you're diabetic or you can't eat gluten, or even a vegetarian. So I was a school teacher, and one of my standards is that before they had nutritious breakfast programs in schools, the teachers would just do it themselves. We realized right away that those behavior problem kids, the kids that weren't learning well, those kids were hungry. And so we ended up buying out of our own pockets. We would buy food and have it for kids. And I can remember going out on the playground with bags of apples and sandwiches, and kids would just run over and grab it because they're hungry. And kids can't learn if they're hungry. And sharing meals at home is also a way of decreasing anxiety, because you can talk to your parents, you can talk about what's going on in school, you can learn to eat by watching your parents eat, by sharing food together. So laughing, talking, sharing meals. Food is a long-term investment for good health.
Having nutritious food is a major social determinant of good health. Without nutritious food, there are huge repercussions. Chronic diseases, diabetes, osteoporosis, heart, and many others. Nutrition is considerably cheaper than hospital stays and medication. Education, as Sherry has mentioned, is very difficult for children to learn when they are hungry. And mental health. Imagine worrying that you don't have enough food for your family. The Feed Ontario Hunger Report of 2019 states that not only are more people visiting food banks, but more employed people are visiting food banks. It's very easy for the government to say, get a job and get off of OW. But the reality is that many jobs that people could get are precarious, low-waged and temporary jobs. Women experience more low-wage jobs, and it's even worse for racialized women. Single recipients of OW are the worst off. Certainly, families with children have benefited from the child benefit, but single people are the worst off. In summary, it is more expensive to save money now by not increasing OW and ODSP because of long-term health costs. A healthy, balanced diet doesn't prevent all health conditions, but it does prevent a lot and delays the onset. Hospitalization, medications, disabilities all cost way more than healthy food. Growing up with a healthy diet helps create strong bones, healthy bodies, and discourages type 2 diabetes. A healthy child is more likely to participate in sports, active play, riding bikes, etc. We thank you for the letter that you already wrote, but we ask you to write another letter, and that it should stress the cost of a nutritious food basket and the urgent need for an increase in social assistance rates to cover the cost. We thank you for your attention.
We thank you, and we have a question. Councillor Nan.
Thank you, through the chair. Thank you, Sherry and Myrtle, for coming in and delegating today. So we heard from the previous delegation that we'd like to hear, to revise a letter to the ministry that my colleague here is working on. And you're requesting the addition of
Yes.
the specificity around the details around the increase of the cost of a nutritious food basket. So the previous delegate had mentioned that in 2018, it was about 101 per month, and that in 2019, it's a 236 average shortfall that residents are facing in terms of their ability to afford a nutritious basket.
Correct.
Okay. Was there anything else that you felt would be important for us to ensure that's inside this
Well, I
letter?
think that is the main point, and I think it's important to stress it's urgent, that people are suffering from this at this moment.
Yeah. And I thank you for bringing the perspective in terms of who's most impacted. Absolutely, everybody on the system is impacted, but it gets compounded when individuals are experiencing other kinds of stresses in life. And particularly those facing, for women as well as racialized individuals. So thank you again for being here today.
Thank you.
And I'll pass the chair to Councillor Nan, and I will ask you, I feel like poverty sometimes is like a vicious circle, you know? It affects every aspect of our life. Do you believe people that don't buy fresh vegetables and they go to fast food, do you think that's more what they would do because it's cheaper, or?
I would say sadly that is true. I am appalled when I see, you can buy 2 hamburgers for $5.
Right, or sometimes they have a special. And
that's, very easy for families, and then children get used to eating that kind of food. And, if no healthy food is put in front of you, you don't know about having it.
Exactly.
And I would just add that you sometimes call that comfort food, so people tend to do that or eat lots of potatoes and
Yes.
pastas and things like that, rather than, like you said, the fresh fruit. And you have to learn how to like it. You have to learn by watching your parents eat and trying new things.
It's exactly right. I just want to say, I was born in Italy, and we would never have dessert. We would have fruit after. So, that's what our culture was. We would have fruit instead of dessert. So when we came here, we noticed a lot of people would have dessert right after a meal. So then you get used to it, and that's what you do. So, but it's so important, fresh vegetables. But I find a lot of people that are don't have the means tend to go out more to these fast foods because it is cheaper, So it's very important. So thank you for bringing that up. Thank you. Thank you. So 8.3, I would like to call upon Elizabeth McGuire, campaign for adequate welfare and disability benefit, to delegate respecting how the low rates of social assistance do not enable a healthy diet. Please come down, Elizabeth.
Well, thank you very much. I'm very happy that Mr. Rula brought up a business stimulus package. And when the clerk hands out our submission, you'll see that I positioned the increase in OW as a business stimulus package to bait the Ford government. You can make money with this. You can grow the middle class. You can increase your tax base. It's all spelled out in the submission when you read it. But, you know, we're talking about today's problems, and these problems are not new. These have been around for centuries. The pharaohs didn't build pyramids to their vanity. They built them to employ the masses of people that were hanging around. And when you have masses of people hanging around, it's going to lead to radicalization, it's going to lead to violence, it's going to lead to fascism, which in Europe many years ago led to war. And you have fascists out here on your forecourt on Saturday. It's escalating, it's alarming, it's in crises. We have to do something. So in order to motivate Doug Ford and his group of people, I sold our increase in rates as $102 million that would be plowed back into the local economy. So that's, I think, a point that is worth supporting. It was in the 30s, and I'm sure no one here remembers the 30s, but if you do research, you can find out that there were a lot of clashes in the streets between police and the unemployed. A lot of clashes, and that's when they actually started thinking, well, we need kind of something to blunt the anger, we need to stop the hatred of us who are elected, and they brought in what they called a welfare state. And that's when they first started handing out checks. Mind you, they were very minimal. And yes, what they're receiving on OW right now is obscene. And it has to be increased. And I think I've made a good argument why they should be increased. And if council chooses to support it, that would be fantastic. About the ODSP, people signing up for it and being ashamed and embarrassed, and it takes at least a year, sometimes 2 years, sometimes abandoned, more often than that, abandoned. And how many people can you run into that say, oh, I've got an ODSP application that I'm working on, but it's dragged on for a long time. So when there was the threat that they were going to change the definition, the campaign and the Shelter Health Network came together and built ODSP clinic, sign-up clinic. The last clinic last month, in 2.5 hours, we signed up 21 people. From opening an app to closing an app and faxing it off to the ministry, 21 people we saved. And that's how we look at it. We're saving people. We're saving people and helping them find food and a sense of dignity. So that's all I have to say.
Thank you, Elizabeth. You sure have compassion in all your work you do, so thank you. But, okay, there's no questions, so at this time, yes, at this time, Councilor Marula has a motion, and can you read it? Okay. May I have a motion to receive the delegation? All the delegation, all of them. All the wonderful delegation. Okay, Councilor Jackson and Councilor Sam? Oh, Sam and Marilla. We're friends. Okay, let's vote first. No, he's carried. Now, okay, Councilor, there you go.
Thank you, Madam Chair. And I want to thank Councillor Nan, who assisted in the motion as well. And it's moved by myself and seconded by Councillor Nan, whereas food costs have increased by 7.6%, whereas access to nutritious food is a key factor in maintaining residents' to thrive and participate more actively in society, whereas social assistance has not kept pace to the actual rate of inflation. Therefore, be it resolved that staff be directed to send a letter to the Premier requesting an assessment and adjustment to social assistance to reflect consumer inflation index, thereby creating a sustainable system process excuse me, to accommodate the most vulnerable, and that a copy of this letter be sent to all the local MPPs.
Thank you, and we need an e-vote for that. Oh, Councillor Clark first.
I think the 7.6% for food was for 1 year in 2019, right? Because it's actually gone up again this year, even higher. Can we confirm that?
What, that's,
It was for 1 year, 2019. Yeah, it was a record over, yep.
okay.
So just
can
say in
we-
2019 and we've got it, because it's gone up again in
count-
2020.
Okay, I will activate.
Yeah,
and,
I just want to thank Councillor Clark for that, for catching that, because in putting this together,
So-
I missed that entirely, and my fault. I take full responsibility.
And do you
so
think
we'll
you
have to
could-
adjust that.
Do you think you could read it again then?
So I'm not sure what that number is, though. So what would the
Oh.
actual accommodating number be? So, yeah, I guess I would like to have an actual number of over the years, but it would give more of a. But what has it been since the last time they raised it? Is my question. Oh.
So,
Do you happen to know, Sally? I know this is very unorthodox. Okay, so since then, that has increased 7.6% since 2018? Okay, I see. Okay, so why don't we just say then, I think Councillor Nan wants to make a suggestion.
Okay, Councillor Nan.
So the first whereas could be whereas food costs have increased by 7.6% in
2019.
2019 and continue to increase
Fair enough. Are we
And
satisfied
go-
with that?
as is.
Okay.
Okay, so we'll amend that friendly and accordingly. Thank
So-
you, appreciate it.
Thank you, and we will have to do a e-vote on that, right? Thank you for the motion, and it passes. Thank you. Okay, discussion, item 10.1. Menstrual products. Move it? Okay, let's talk.
Oh, if,
Okay,
maybe if we can have staff to just give us a
Yes,
brief update, and
actually,
then
I was going-
if you can come back to me, that'd be great.
yes, that would be great. General Manager Paul Johnson, can you talk about this 10.1, please? Can you or will you?
Through the chair, that sounded like an extremely loaded question. And I'm going to say no, but I am going to have Grace speak to
Oh,
it, who actually helped alongside. I do want to thank Mark Weingartner and Leanne Sutherland for their work on it too. Mark works in Children's Services and Neighborhood Development. Leanne is with Ontario Works. They did a great job, but I'll let Grace take you through the specifics.
Okay, thank you. Grace.
Thank you.
Grace?
Through the chair. This was a follow-up to a Board of Health discussion about menstrual products being made available throughout the city. Staff, motion was put forward and staff followed up on a different approach to try and look at a more directed for low-income access. What you have before you is a report that we think provides a couple of options, both a universal and a targeted approach, so that we could look at as a pilot. We were very fortunate that Joanne Santucci from FoodShare reached out to the city with a fabulous opportunity to work in conjunction with the food bank. So we were really very fortunate for that. And we think that this option could provide us an opportunity to look at two different ways, through food banks and through a targeted approach with a certain number of recreation centers, to really get an understanding about the level of need and the cost that it may be associated.
All right, thank you for that. And Councillor Marilla.
So thank you, Madam Chair. And firstly, I want to move this particular report, and seconded by Councillor Nan. And just to give some brief history, as you can recall, I had mentioned at council that during our inaugural evening, a number of us were over at the Sheraton prior to the event, and I ran into a woman by the name of Halima Al-Hatima. And did I pronounce that properly? Hatimi. Sorry. So anyway, I was unaware of what she was working on or the initiative that she was bringing forward. So she came up to myself and Councillor Collins, I believe, and Farr, introduced herself, provided us with a brief description of what she was pitching or proposing, and that she would be in front of us in the near future. And lo and behold, within a few weeks, she was before us, and a motion was developed. And so in bringing forward that motion, the focus really was to try to create an environment that was conducive to just focusing in on those that need it the most. And when we were looking at other issues and some of the arguments for and against, I think for the most part, and in my consultation with community, particularly women, in saying that this is not only necessary, but should have been in place many, many years ago from a socioeconomic perspective. So the intent of this is not to have everyone have access to it, but to target certain socioeconomic areas that potentially might be disadvantaged enough to be able to suggest that there would be more need or demand. And I want to thank Grace, because I think the report is very thorough and it's a good one, but I think it would be remiss of us not to applaud Joanne Santucci, who's here today, with her involvement in this at the food bank, and we need to applaud her not only on this front, but on many other fronts, obviously. But I think we have to, and I'm glad that council supported the initiative, and I'm confident they're going to support the continuation of this, because I'm convinced that council does recognize, and has always recognized, that we need to step up to the plate when the demand is there, particularly for those that are most marginalized. And I know it's easy for most men to dismiss this as a non-issue, but being a brother of 3 sisters and the son of a mother, I grew up in an environment that was very, very heavily influenced by women. And as a direct result, I actually thought most of these menstrual products at one time was a toy. And I can assure you that my sisters and my mom were not very pleased with what I did with those particular items when I was a child. But having said that, children will be children. And lastly, I do want to emphasize that from a social perspective, this really is something that should have been in place many, many years ago, and I appreciate your time. Thank you.
Thank you. Councillor Nan.
Thank you, through the chair. Happy to second the motion, and also thanks to staff for preparing the report, and also to Food Share for leveraging their distribution power. As I was consulting around this issue well before, it's part of the women's issues that we've all been advocating for those of us who've been focused on health equity. And particularly after FemCare came in December 10th to delegate to the rest of council around the need to fund menstrual hygiene management and products for distribution to women who are disenfranchised, as well as trans individuals who menstruate. And so fundamentally, this is a health equity issue. It's ideally we would have liked to see a larger, some of us would like to have seen a larger distribution and access availability. However, I'm encouraged by some movement, and fundamentally a movement for a 12-month pilot project, so that we can assess the outreach, the impact of being able to provide guaranteed supply. I know for many of the food banks that receive supports through Food Share, part of the inconsistency and inequity in that system is that it relied on donation of menstrual products in order to distribute them. So by guaranteeing this this portion of the motion, it allows us to ensure that our network and the emergency food network is able to guarantee a supply for distribution for women and for folks who menstruate. So I'm happy to second the motion. Thank you.
Thank you. And I will pass the chair to Councillor Nan, because I have a few questions. As I looked at this, I thought for the rec center, Grace, can you explain how that would work?
Through the chair, we've came up with a couple of options, and we felt that the most way to run the pilot would be to have access within the washrooms. There would be a supply available in a basket that through recreation staff, they would be monitored and resupplied on an as-needed basis.
That's good. I remember when you had dispensers. So I know it said it costs more to put a dispenser, and I'm just wondering, how would you come up with, if a person is in need, they go to the basket and take the whole basket with them? Because obviously you don't just need one. So how would that work? Would they ask for the whole basket of supply?
Through the chair, that'll be part of what we want to look at through the pilot process to determine what is that level of need. I think we're making some assumptions before it, but we're going to learn from it and then determine on an ongoing basis, and we'll report back what we learn after the 12 months.
Grace, as I looked at this, I thought option one was better. I know it costs more, but I was thinking if we're really targeting the people that need it most, because I've been to restaurants where they have a basket with that. I've been many places, different areas, where they have that. And in a sense, it's helping everyone, right? It is targeted. It should be for that. And all the food shares and food banks, I think it's great to do that. I think we must do that. But I just don't see it, a basket there, and how it would work. So in option one, it says that if we gave $7.25 to everyone that needed it on ODSP or Ontario Works, it would cost us about $591. We are spending $111, and we don't know what we're doing, But option one, that was the whole thing for people who need them. For people, it's called period poverty. I was approached because of that. And so in my understanding, if I look at this report, I think it makes sense, option one. So can you give me your thoughts on that?
Through the chair, one of the reasons we chose not to recommend that as an option is we felt that, $7.25, and that was only to those on Ontario Works.
Right.
It did not include the ODSP caseload.
Okay.
It would also, this money is also being redirected from our special supports allocation. So as we redirect money from that, that means us determining about what we're not going to continue and supply. So $500,000 from that fund, it has a tremendous impact. So we felt that if we went with the option we put forward, it was not as much money being redirected from other supports, and we could then determine whether it worked or not.
Okay, Ontario Works, do they give extra money for personal hygiene? Is theirs?
Through the chair, no, they do not. It's included within the basic needs amounts on the OW rates.
It is. As I see this, I just want to help the people that really need it. And I just don't, I know the food banks, like people donate to food banks and all that, and I know that I've been to a few of them and they had some, so a good donation would be great, they could buy them. I just don't see how we're going to monitor it, that's all, in the rec centers. And how many rec centers do we have? Chris?
Through the chair, including arenas and community halls, we have approximately 70 major recreation facilities.
70. So if we have 70, and this pilot, we noticed that people are using it, and will we open it to all the rec centers?
Through the chair, that's what we'll report back on as to how successful the pilot was, and then determine about if this is something that is the will of council, then we would look for that direction.
So I'm trying to figure out if it costs, what, 30,000, did you say? And 30,000 times 70, that's over, what's that, over 210,000, I guess?
But 6,000 per location is what we're estimating.
6,000 per location. So that gets up there, too. So as I read this, I thought it'd be great if we could give the money for the people that really need it, and it would help them, you know. But that's option, so we'll have to vote for that. But anyway, that's my thoughts. I want to be there to help people. I want to make sure everybody's looked after that needs it, you know, and that's what it was all about. So thank you, Grace. Okay, we have a few other speakers. Councillor Clark.
Thank you very much, Madam Chair, and I want to thank you for suggesting option one. I mean, it's a very magnanimous gesture and incredibly charitable. I think some of the challenges that our staff are indicating in terms of we're not set up to do that type of thing, and ODSP would be excluded, and there are other people who are poor who are not receiving Ontario Works or ODSP that also would need access to the products. And so I think the pilot, as a first step, we might get to where you're going, but as a first step is very prudent and wise. I think, and I'm confident that with Ms. Santucci and Food Chair and all the food banks collaborating with us on it, it enables us to spread the product out further. I'd also suggest that we might want to use some of the expertise of Ms. Santucci in reaching out to perhaps the manufacturers of the feminine hygiene products and getting a better deal on the products, as opposed to municipalities. We're prone to, okay, we've got the money, we're going to go and buy the product. It's easy. It's, you know, all done. But I've known Joanne a long time, and she's pretty creative, and she knows a lot of people. And I would suggest that working with her in this collaborative style to see if there are ways and means to leverage, I think that's the key word, leverage, with the manufacturers. We might find that we'll get more product, which will enable the pilot to be even more successful. Then after 12 months, we can assess whether or not we can move that out to all of the rec centers accordingly. So I think your heart's in the right direction. I agree 100%. But I think the premise for me was to get it to those rec centers and those communities and those people that need it the most in the pilot. And then once we've got it ironed out, we can start to look at how we would provide it further and just maintain that collaborative spirit so that we're working with the food banks, Food Share, and the manufacturers to help the people that need it the most. So congratulations to staff. Thank you very much for your assistance.
Thank you.
Much appreciated. I think this is a great solution. Thank you.
I will pass the chair. I have one more question to Councillor Nan. Is there any way we could write the Ontario, do a motion to see if Ontario Works and ODSP can get a personal hygiene credit? Is there, we just passed a motion for the increase for food. Why don't we write a motion for personal hygiene?
Through the chair, absolutely.
Okay. I think we should, because I see it as really targeting the people that need it. So if the clerk could help me, I would love to put that in motion, or I'll... Okay, all right, and we'll do that. We'll keep going, and at the end, we'll do that? All right. So thank you, Grace and Paul Johnson, for that report. Okay, may I have a mover and a seconder? Councillor Clark and Councillor Marula and Councillor Nan. Okay, Evo? I didn't see your hand up, and yeah, I was on standby. Did you write it? Thank you. Okay, 10.2, allocation of funds to continue the emergency home repair program. Move it? Second it. All in favor? Electronic vote. Okay, thank you. Okay, 10.3, school board labor disruption. Is there any question to staff? Any? No? May I have a mover and a seconder? Councillor Clark and Councillor Jackson. No, it's all in favor? Carry. Okay, motion 1. Councillor Nan, do you have a motion? Will you introduce your motion? Okay, thank you.
Thank you, through the chair. With thanks to staff for preparing the motion, this is a bit of a housekeeping. Ministry of Education Community-Based Capital Project, CBCP funding to the Bernie Morelli Early On Child and Family Center. So whereas the Ministry of Education provides and approves funding for community-based early on and child care capital program projects, and whereas the repair costs for the former King George School at 77 Gage Avenue North, Hamilton exceeded the approved funding, and whereas Bernie Morelli Rec Center at 876 Cannon Street East, Hamilton is located in the same neighborhood, quite adjacent actually, to the King George location and provides an opportunity to co-locate services and families, and whereas the funding for the Early On Child and Family Center project located at the former King George School was deemed unneeded due to the extent of the repair and costs for that facility, whereas the Ministry of Education has agreed to allow the City of Hamilton to utilize the Early On Child and Family Center portion of the King George CBCP funding towards the creation of an Early On Child and Family Center at the Bernie Morelli Recreation Center. Therefore, be it resolved that $510,000 be allocated to the community-based capital project funding to Bernie Morelli Rec Center, project account number as stated, as approved by the Ministry of Education, and that B, the General Manager, Healthy and Safe Communities be authorized and directed to execute any required agreements and ancillary documents in relation to funding the creation of an Early On Child and Family Center at the Bernie Morelli Recreation Center with such terms and conditions in a form satisfactory to the city solicitor. And again, this is great because we were able to find some underutilized and space that could be renovated at the Bernie Morelli Center. It keeps the services in the neighborhood where the need was already identified. It co-locates between the rec center, an elementary school, a high school, and a thriving neighborhood where we have many young families moving in and also existing families as well. So moved by myself and seconded by Councillor Marula. Thank you.
Okay, thank you. So we'll require a e-vote for that. Oh, sorry. Okay. Okay, general information business. 13.1.
Madam Chair, sorry, we'll do your motion now.
Okay, thank you. Thank you. Yes, I'll pass the chair to Councillor Nan, and I will read this. I'll do the whereas. Whereas there is an ongoing city cost for feminine hygiene products for those receiving OW, ODSP. Be it resolved that the City of Hamilton be advocate to the Province of Ontario to increase the basic needs award amount to cover the costs for feminine hygiene products. I need a seconder. Councillor Marula, thank you. And all in favor, let's see, vote. Oh, I'm not, oh, sorry. Oh, yes.
Moved by Councillor Paul, seconded by Councillor Marula. Electronic vote.
Thank you.
Councillor Pauls, if you could vote. Carried, and I pass the chair back to you.
Thank you. Okay, general information business, item 13.1. Items considered complete to be removed. 13.1 and 13AB. May I have a mover and a seconder?
Madam Chair, the item 13.1A, AA, the Residential Care Facilities Subsidy Program Review, we're not voting on that because we're going to bring it back again. So that's going to stay on the OBL.
Okay.
So you're just voting on the second item, the menstrual products item.
Okay, so 13.1AB, may I have a mover and a seconder? Councillor Nan, Councillor Marola, electronic vote. Yeah, last. Okay, we have a private and confidential, 14.1. Member of the committee, do you wish to move into closed session? No? If no, then may I have a mover and a second to approve the closed session meeting, January 16. You vote, please. Marola and Councillor Jackson. Whoa, you guys. You make me nervous when you stand up. Thank you. Thank you. May I have a mover and a to adjourn? Okay, we have to vote. May I have a mover to adjourn? Councillor, okay. Councillor Jackson, Councillor Marola. Thank you. Thank you very much, and thank you for your help. And Councillor B. Every time they stand up, I get nervous. I don't know where